I have the great pleasure of introducing Dr. Albert Zhou. Dr. Zhou is associate professor at the Johns Hopkins Bloomberg School of Public Health. He studies how organizational practices and employee work experiences affect the mental health, safety, and well-being of employees and their family members. Specifically, his research has examined the impact of workplace mistreatment. His research also focuses on promoting organizational and worker practices to improve workers' productivity, physical health, mental health, and overall well-being. He is currently an associate director of the Journal of Occupational Health Psychology, Group and Organizational Management, and Stress and Health. Everyone, please welcome Dr. Zhou.
Thank you. I also want to thank Paul and David for the very engaging discussion. Some of the topics that I will talk about today actually have overlapping themes with the LGBTQ plus community's experiences in the workplace. So I'm going to touch base a little bit more of that when we get to that point. My name is Zhou. I go by Albert because many people cannot pronounce my name. So it's Albert Einstein first name when I came to the States. And because both my first and last name start with Z, now I something starting with A. I'm working in the School of Public Health in the Department of Mental Health, but my background is in organizational psychology. So my training is to study how human behaviors take place in the workplace and how we can create a productive and healthy and happy workforce. So quick overview of what my talk will be about today. First, I want to briefly discuss some of the connections between work and the mental health. So before I joined School of Public Health, I was working in psychology department. So we talk about occupational health psychology or organizational psychology. Mental health is a part of our research, but we rarely use the term. And also, many researchers and practitioners in the organizational settings try not to talk about mental health or use the term mental health a lot until recently after COVID. So mental health in the workplace became one of the arriving themes. Actually, this year's World Mental Health Day have the theme of workplace mental health. So we see this increasing attention to mental health in the workplace. So I want to briefly introduce the connection between work and mental health, and also just to share some of the findings from my field, not necessarily my own research, but my field of the risk and protective factors for mental health in the workplace, and also a brief discussion about the potential workplace mental health promotion efforts and how they can potentially promote mental health in the workplace, and also some, I think, some of the directions that are worth pursuing, and also something that I'm pursuing in my research program. So these are some statistics that I think many of you are familiar with, such as 1 in 5 of US adults have experienced mental illness based on each year, based on the CDC numbers, and also just some large numbers. We have about 133 million US adults who are full-time employees as of 2023, which is a large group of population. And also, unfortunately, we are working very long hours and years in the States. So the average work life is estimated to be 42 years in the States. It's 36 years in EU, so it's a little bit longer in the States. And also, there is a recent report from American Psychological Association from last year, surveying workers and asking them how have they experienced stress in the past months at work. And as we can see, the number is very high, 77%. It was 79% in 2021, right after COVID. So it's a little bit decrease, but not very meaningful decrease. I think we talk about the social determinant of health, and this is a framework that I got to learn since I joined the field of public health. And we never talk about it in organizational psychology setting or management settings. But if you think about the 5 pillars of social determinants of health, they closely relate to the work aspect of people's life. Education access and quality, one of the known antecedents of occupational prestige or occupational attainment. And think about neighborhood and built environment, again, where people were born and raised are associated with what kind of job they might be exposed to. And healthcare, economic stability, they are part of people's work-related experiences. being in a more prestigious job or high-paying job, offering the stability, offering the a better healthcare coverage. Those are some of the benefits that not everybody have the access to or have different levels of access. And also social and community contacts, as we talk about, as a community, LGBTQ plus population is a community, and workers have their own community in and outside the workplace. And to an extent that people have positive social interactions will determine their health and well-being as well. And also, many of you are also familiar with the U.S. Surgeon General's framework of mental health and well-being in the workplace, which highlights 5 pillars that organizations should focus on to promote worker mental health and well-being. This is not an exhaustive list, meaning that we just need to focus on these 5 pillars. We're all good. It's not. But these 5 pillars are reflect from the core domain that researchers have been focusing on, and also some of the gaps are still missing in research and practice, including protection from harm, which includes both physical harm, such as accidents, injuries, and near misses, and psychological harm, like discrimination, harassment, incivility, aggression, violence. So we talk about creating a psychologically and safe and physically safe environment will be very important for workers' mental health and well-being. And as a part of the social determinant theory model, connections and community in the workplace is also very important, especially after remote work or hybrid work became more popular than before COVID. So we see people preferring to work in hybrid work mode, but also report to experience higher level of social isolation and loneliness, which have negative implications for health well-being. Creating policies and procedures and resources to promote work-life balance, and also create opportunity for people to find their work meaning and also have the opportunity for growth. They're all important aspects of the workplace that it can promote mental health and well-being. So with that, these are most of the background, and I think it's pretty clear that the workplace can play a very important role for our mental health and well-being. So they can expose workers to risk and protective factors, and also it provides an opportunity for potential promotion and intervention efforts. So not only we need to focus on individualized, many of you are medical professionals, you focus on treatment and individualized trainings and treatment, but the workplace can also be an opportunity where we create systematic changes to promote mental health and well-being and also create positive experiences for workers in general. With that, I also want to introduce a field that, in case you haven't heard, this is my training background. So my background is in industrial and organizational psychology with a focus on occupational health psychology. So this OHP has a long history for about, I guess, 40, 50 years. There are different definitions, one from National Institute of Occupational Health and Occupational Safety and Health, and the other is from our own society. I bolded a few words just to highlight that it should take a village, meaning that we should have the partnership among people from psychology, which is the most important, I guess, so far, the driving force of this field, and also other occupational health professionals, including everybody who are in the room and also on Zoom. We all can contribute to the field of occupational health psychology to create a safer and happier and healthier workforce. But unfortunately, as far as I know, at least before I joined Hopkins, most researchers in this field are from psychology, less from occupational health sciences. So with that, also, I'll skip these 2 models for the sake of time. These are some of the theory that we use in occupational health psychology to understand how work-related exposures might affect health and well-being of workers. One is the job demand control model, one of the most commonly used model to understand stress in the workplace, and one is the job demands and resource model of a burnout. So healthcare workers are one of the workforce that has been experiencing increased level of burnout, especially after COVID. And job demands resource model is one of the leading models to explain how we can manage demands and create resources to reduce the experience of burnout for workers. So I want to use the next few slides to briefly introduce some of the key risk factors that has been studied in the field of occupational health psychology to understand to what extent people experience in the workplace, ranging from a whole economic level to organizational level to team level, and all the way to individual and interpersonal levels, can drive mental health related challenges, and also point out where interventions and trainings should focus on. So I'm using this diagram to briefly summarize some of the higher level, macro level to micro level exposures. Think about economic stressors like the stock market change, the economic changes, and security, financial security, job insecurity, and all the way to individual organizations or employers. To what extent organizational level experiences or policies or changes can trigger potential issues in workforce, and also the way that people are performing their roles. So each of us have our own individual work roles, but there are descriptions about what each of the role is supposed to be involving, but there are many stressors that might be occurring at that is reflected in the role that we perform. And also in terms of our daily task, we perform daily tasks from, I guess, spending 3 hours on emails every day, and then like interacting with coworkers or deal with work demands. All those individual tasks can also expose workers to many challenges, and also to the interpersonal experiences. So I think Paula and David's presentation relate to their presentations. The workers' experience in the workplace, especially workers with marginalized identities, to what extent they have negative interpersonal experiences is a very important trigger of mental health challenges and their leading a particular organization or workforce. And also one thing that I think there has been, at least so far based on my listening of the presentation, that's focused on the work and family interface. This is one of the rising topic in workplace mental health or occupational health psychology, because we don't exist in isolation. We have our work role, we have our non-work role. The non-work domain can be very broad. It can be our partners, spouses, children, family members, and also other non-nucleus family members, or the community that we belong to. It can be a religious community, social community, or just friends and people that we interact with outside work. To what extent the interface between work and non-work domains can be a positive experience or a challenging experiences can also affect workers' mental health, as many of us have our personal experiences. So I'm going to give a few examples for each of the stressors that presented here to give you a sense of what the literature has been studying. And some of them are within my research focus. I will talk more about those, but some of them are not my research focus, but I still want to give you a brief introduction about what has been done about the specific stressors. For the economic stressor, I want to talk about one of these stressors that has been studied a lot, which is job insecurity, the extent to which people perceive that they have the continuity and the stability of employment, and that they're currently experienced. So people's job insecurity levels, generally speaking, the population level fluctuate based on the overall economic situations. So think about in 2022, we did a survey of our own research team. In 2020, late 2020, we people report very high level of job insecurity. In 2009, when I started my training, and it was pretty high right after the recession. But in 2015, 2016, we see better perceptions of job insecurity. But from the individual perceptions, people do have different levels of job insecurity that is less affected by the overall economic situations. And the experience of a higher level job insecurity can affect the mental health and well-being of the workers. So these are some of the known findings linked with job insecurity perceptions, including burnout, emotional exhaustion, and depression. I also want to highlight that in organizational research, we use the word depression very loosely. When we talk about depression, it's mostly referring to depressive symptoms instead of a clinical diagnosis of depression. And also, it can they are linked. The perception of a higher level job insecurity, especially persistently, are linked with worse physical health as well. And also, there is evidence of a reciprocal relation between job insecurity and mental health depressive symptoms, such that experiencing chronically higher level job insecurity will be linked with higher level depressive symptoms later. And also, being at a higher level of depressive symptoms will contribute to the development of higher level job insecurity. This is not saying this highlights that our experience of job insecurity is not just affected by the overall economic situation, but also the mental health condition that people are in. At the organizational settings, there are many things: organizational politics, justice, and climate, and the changes can affect workers' health and well-being. One example I want to present is organizational injustice. One of the core stressors people can experience from the organizational settings. They are associated with the outcome people might receive, like are people getting paid enough or getting the result that they're expecting. The process of getting the result, whether that's fair or not, the procedure of getting that, and also whether people are receiving just fair treatment interpersonally, the interpersonal aspect of injustice. So these three types of injustice has been studied over half a century, and has been consistent research showing that experiencing any of this injustice will trigger potential mental health and well-being outcomes and challenges, and highlighting that we got to create a more just environment, and think about, again, linking to what Paula and David has discussed, to what extent people with marginalized identities or people of racial and ethnic minority groups are treated unfairly or injustly in the workplace. The interpersonal aspect and also distributed aspect and procedure part, they're all linked to potential have the potential to link to worse mental health and well-being, and also the potential turnover of workers from a particular organization or industry. Role stressors, two example role stressors that have been studied for probably 50 years as well, from the 70s, are role ambiguity and conflict. To what extent people feel that there is ambiguity in what they do, and also there are conflict in demands. And many people do have this kind of experiences on a daily basis, and this kind of stressors associated with one's role in the workplace has consistently been linked with worse mental health and well-being outcomes, such as depression, burnout. And task stressors, I want to use workload as an example. Workload is considered as a challenge stressor in our field, meaning that it could trigger people to be more motivated when there is a certain level of workload. But extreme higher level workload, long working hours, or just have to be constantly cognitively and emotionally invested in job can be a challenge for people's health and well-being as well. So in general, excessive levels of a workload has been linked with many mental health and well-being challenges as well. Interpersonal stressors, this is one of my core research area in the past 15 years, studying why people, first, what are the impact of being victims of all kinds of workplace mistreatment, all the negative interpersonal experiences in the workplace, and why people are victims. We're not blaming the victims, but we're trying to understand what might put some employees in a more vulnerable situation, how we can avoid that or protect them. And also why some people are more likely to be the perpetrators of workplace mistreatment, and so that we can prevent them from happening as well. So my research has focused on three domains, and also how organizational practices can help with protecting potential targets and also reduce the perpetration of workplace mistreatment. And there's no doubt that the experience of mistreatment have negative impact for worker health and well-being. There's consistent research on that. But in terms of efforts that it can potentially prevent the occurrence of workplace mistreatment, either from the victim perspective or from the perpetrator perspective. The research has been less, I think, promising. There's less research on that, and there's less focus on intervention, and also less consistent findings on what intervention or practice might work. This is one of the areas that I think needs to be that needs to be focused more by research from all disciplines, including psychology and occupational health sciences. And also the interface between work and the family, the experience of conflict between work and non-work. So again, family, we talk about work-family conflict, but family is a broader category. So we talk about mostly referring to the non-work domains. So the experience of work or work and non-work conflict is one of the core stressors that might affect not only productivity in the workplace, but also many aspects of our life and health and well-being, including life satisfaction and stress and depression, and physical health, and also generally speaking, family satisfaction, and also interaction with children. So work-family conflict or work-non-work conflict can occur in both directions, work to non-work and also non-work to work. So the creating a balance that people strive to get is a very important goal for many workers and also organizations. I'll talk a little bit more about some of the effective practices that might help with creating better work-life balance. So, so those are some example stress risk factors for mental health and well-being that we have studied in the field of occupational health psychology. And also we have talked about some of the protective factors. We have studied some of the protective factors for mental health. And also using a similar framework from a macro level to macro level. We can talk there are organizational practices and climate building, social support from team level, from individual level, and also personal resources building. They can all potentially serve as protective factors against mental health issues. From the organizational level, one example, the policies, is work-family supported policies. So we see an increase of the demands of those policies. There also an increase of provision of such policies in organizational settings. They can be dependent care assistant to meet the need for care for dependents. They can be flexible work arrangement, such as flexible hours or flexible location, telework or modified schedules. Especially after COVID, we see a strong need for this kind of policies and practices, and likely many organizations are offering that. But also we see a trend of organizations pushing for return to office, fully return to office, 5 hours a day, 5 days a week, apologize. And we see the discard for flexible or schedule or hobby work modalities. But generally speaking, workers prefer to have a more flexibility, and the existence of such policies could be beneficial. And also some general support related to family-friendly benefits and work-family supportive policies. Generally speaking, these kind of policies are certainly as important resources from organizational levels to promote better employee mental health, well-being, and morale and productivity. So these are some of the demonstrated positive impacts of having more such policies. But I also want to highlight that the availability of such policies by an organization or an employer is not equal to workers' utilization of such policies. There are many barriers for workers to utilize the policies to the extent that they prefer to. Many things are related to stigma, related to politics, and also relate to how a leader and co-workers are treating the individual workers. And such barriers would block workers' utilization of such policies and enjoy the benefits of such such policies. So reducing barriers, reducing stigmas, and creating more opportunities for workers to utilize the policies that are available is one of the core research areas as well. Climate, and there are many climate that we talk about. Climate generally refer to perceptions of policy, procedure, and practices in the workplace for particular focus. There's safety climate, especially in some of the blue collar industries. Safety climate is a core protective factors such as construction. Creating a safety climate can potentially promote better safety behaviors and reduce injuries and accidents. There are also inclusive climate and inclusion climate and diversity climate. And this example that I gave is violence prevention climate. Since this is one of my core research area. So this climate focus on employees' perceptions about the extent to which organizations have policy, procedure, and practices that focus on preventing, that focus on keeping employees from violence and abuse. Of course, we use the term violence, but it generally refers to any kind of interpersonal mistreatment, which includes harassment, incivility, abusive leadership, and also physical aggression and physical and psychological violence. Creating a stronger violence prevention climate has been linked with reduced exposure of violence by the workers, and also a better mental health and well-being outcomes. And also I want to connect back to what Paula and David has talked about. So my recent PhD graduate who graduated this year and who started his tenure track position this year, his dissertation focused on incivility experiences experienced by LGBTQ plus workers, because we want to focus on this incivility is very similar to microaggression, as Paula mentioned. So we want to study to what extent LGBTQ plus employees are experiencing more incivility in the workplace, or similar level compared to their non-LGBTQ plus coworkers. And we found that yes, they are. When we talk about overall their experience of incivility, the rudeness people experience in the workplace from other workers, they experience more incivility than non-LGBTQ plus employees. And when we link the experience to their mental health and well-being outcomes, we found that yes, it has contributed impact on workers' mental health, well-being, and also health-related behaviors. We're still working on that topic, and one thing we found that is promising is experiencing higher level diversity and the inclusion climate is associated with less experience of incivility in the workplace by LGBTQ plus employees. So again, the importance of creating a climate for safety, for inclusion, for violence prevention, those are important to promote workers' experiences and workers' mental health and well-being. Social support, we all interact with people at work to an extent. Our co-workers and supervisors, our social support is critical for our daily work and non-work experiences. One example I want to share is family supporting supervisor behavior. It's kind of social support from supervisors. To what extent a supervisor is respectful and aware and willing to support workers' work family needs has tremendous impact on workers, not just work productivity, but also mental health and family outcomes. So I won't get into the definition for the sake of time, but I want to highlight one thing is this is the one, at least from the organizational psychologist field, there has been established interventions to promote supervisors, family supportive supervisor behavior, which has demonstrated effectiveness on workers' work-family interface and better outcomes in the work domain and in the non-work domain. So I just hope that there'll be more research to focus on interventions in the organizational settings that it can promote better worker experiences. Personal resources, the field has talked about recovery a lot. So I won't go into a lot about, some of the things the organizational practice a lot, having yoga sessions and having mindfulness. There are evidence of their effectiveness, but there are many other things that we can help workers to engage in to promote better health and well-being. One of them is recovery. So recovery is what people might do after work or during working hours that it can help them to recover the resources devoted to work demands. There are 4 types of recovery experiences that has been studied for probably 20 years after working hours. And your attachment to it is when people stop think about work or stop doing work. So not checking emails, not replying emails, not talking about work will help. It's hard to do, but it will help. I can do it myself. So what I do, I relax. So you don't have to do everything, but these are something that people might have their own preferences. You can relax with the family members. You can do experiences that engage in learning something, or just something that help you gain control. And physical activities as part of that. So if I can't stop thinking about work, I go for a run. I will stop for sure. Think about work. Also, I want to highlight one thing in case you are interested. There is increase of interest about how we can promote recovery during working hours. So we don't have to wait after we leave the working space, or we don't have to wait until after 6 p.m. to engage in recovery experiences. And if you have somebody you work with or you supervise with, offer potential in-work recovery opportunities can help as well. So there are micro breaks, there are work-related strategies, meaning that micro breaks is, as we know, we'll take a 15 minutes break, not think about work or do something relaxing, or change the work that we do from time to time. So you don't have to stop working, but instead of writing emails for 3 hours, we write emails for 1 hour and do something else, and then come back to emails. There are also other characteristics of breaks that people might that people take might have different implications. How long the breaks are, how frequent they are. So longer, less frequent breaks are equally effective as shorter but more frequent breaks. So we can change a little bit from time to time, longer versus shorter, frequent or less frequent. The location of break, whether people can take a break on their workstation or leave, or just take 5 minutes to walk outside the building can help. Timing the breaks in the afternoon are more effective than breaks in the morning. So if you can build in more breaks in the afternoon will be helpful. And also there's something that people can do during work breaks, like to relax or to learn something new, or just distract yourself. Different activities might have different implication for our recovery experiences during our working hour. There are many workplace mental health promotion efforts. Some of them are already touch-based, including policies and programs, and some of the team building and supervisor training. Some of them are individual-based training and programs such as resilience training, mindfulness, meditation, yoga, and breathing activities. They all have their pros and cons. Generally speaking, if you look across all the workplace mental health promotion programs and efforts, they are generally showing positive impact, but the results are not always consistent. And there are systematic reviews, large population-based studies, etc., and it's not consistent it's not showing consistent evidence that they will help, meaning that more work are needed to understand how we can create more positive work-related experiences and exposures to promote mental health and well-being. Some things that I want you to focus on in case that you are interested in discussing. First, interdisciplinary partnership. I'm a psychologist. many of you are doctors and physicians or occupational health scientists or researchers or practitioners. We share a lot of shared goals, and it takes, again, a village to understand how we can make the work-related experiences more positive and beneficial for work, mental health, and well-being. And also more focus on intervention and promotion. At least in organizational settings, it's hard to do this kind of research, but there is more, there's a need for more research and evidence to demonstrate what promotion or intervention efforts are working for a certain organizational setting or certain industry. And also more focus on vulnerable workers in certain vulnerable population industries, such as healthcare workers, such as a worker in construction industry, workers in farming industry, etc. So there are many industries that workers are more vulnerable to physical challenges or psychological challenges that are affecting their mental health and well-being. And lastly, there are a lot of focus it needs to be more focus on the potential disparity in work and health related experiences. I think we touched base a little bit about the intersectionality. Like my research, we focus on what we call selective incivility. To what extent people are more likely to become the victims of incivility in the workplace because of their marginalized identity, such as their race, their ethnicity, their sex, their sexual orientation, etc. So the intersectionality of all those identities can increase the experience of work-related, workplace mistreatment, including harassment, aggression, violence, and incivility. And understanding those experiences and helping organizations creating supportive environment to reduce such occurrence will have a lot of implication for millions of people, as we have learned. There are millions of people who are part of this group and population that they need support. And also, generally speaking, creating a safe and supportive environment will be important for workers' mental health, not just themselves, but also their spouses, their partners, their children, their family members. So we are talking about creating a safer working environment, but having broader implications for the whole community and society. All right, so that's all my presentation. This is my email in case maybe you have interest of anything that I talk about today.